You've done everything right. You meticulously manage your blood sugar, diligently take your medications, and carefully adhere to your diet. Yet, why do you still feel utterly exhausted? Why are your hands and feet still numb and tingling? Why do your wounds take forever to heal? The truth is, millions of people living with diabetes are suffering in silence, unaware that the root of their persistent struggles isn't just about blood sugar levels. There's an overlooked secret, a massive gap in how we typically approach diabetes management. In this video, I'm going to reveal the hidden micronutrient deficiencies that are silently ravaging your body, exacerbating your diabetes complications, and most importantly, how you can turn the tide and reclaim your health. If you're ready to take back your energy and your life, make sure to hit that subscribe button right now. Hello, I'm Dr. Michael Bennett, a nutritionist with over 20 years of experience. I've witnessed countless diabetes patients struggle with persistent symptoms despite their best efforts. The traditional healthcare system, while vital, often focuses almost exclusively on managing blood sugar and prescribing medication. And while those are crucial pillars, here's what very few people are talking about: the disease of diabetes itself, and sometimes even the medications prescribed to treat it, are silently depleting the very building blocks of your health. Essential micronutrients. And here's the critical insight: this depletion isn't just a consequence of diabetes. It is a core underlying cause that prevents you from truly getting better, from fully thriving. You might be surprised to learn just how common these deficiencies are and how they're silently wreaking havoc on your body even when your blood sugar numbers look good. We're going to dive deep into these hidden heroes and villains that are shaping your diabetes journey. The foundational trio revisited. We're going to start with 3 heroes that are foundational to overall health, but for individuals with diabetes, they become absolutely critical. And today, we're going to dig even deeper into why they are so often overlooked and why their deficiency is a game changer. Number 1. Vitamin B6, Pyridoxine, the nerve protector. First up, vitamin B6, also known as pyridoxine. Its role is absolutely vital for healthy nerve function, reducing levels of homocysteine, a compound linked to increased cardiovascular risk, and playing a key part in glucose metabolism. Think of it as a crucial support system for your nervous system and your body's energy factories. But here's the silent enemy for diabetics. High blood sugar actively accelerates the excretion of B6 from your body. This means your body is losing it faster than a healthy person. And a significant point often missed is that common diabetes medications like metformin and even some blood pressure medications are notorious for depleting your B6 levels. This isn't to say these medications are bad, but it means you need to be aware and proactive. So, what are the warning signs? You might experience symptoms commonly mistaken for diabetic neuropathy: numbness, tingling sensations, or even muscle weakness. You could also feel profound fatigue or a persistent brain fog that just won't lift. The good news is you can find B6 in powerful superfoods like chickpeas, salmon, and turkey. If supplementation is needed, the best form is pyridoxal 5-phosphate, or P5P, which is the active form your body can readily use. Let me tell you about Sarah, a patient with type 2 diabetes. She meticulously managed her blood sugar, but she was plagued by constant numbness and tingling in her feet, coupled with extreme fatigue. Her A1C was stable, but her quality of life wasn't. After testing, we discovered a severe B6 deficiency, largely due to her long-term metformin use. Just a few weeks after starting the right form of B6 supplementation, Sarah's nerve symptoms dramatically improved, and she reported feeling significantly less fatigued. This is the power of addressing the root cause. Number 2. Vitamin E, the antioxidant shield. Next, let's talk about vitamin E, your body's ultimate antioxidant shield. In the context of diabetes, where high blood sugar creates a storm of oxidative stress, vitamin E steps in to protect your cells and blood vessels from damage. It also plays a role in improving insulin sensitivity, helping your body use insulin more effectively. The silent enemy here is the sheer volume of oxidative stress in a diabetic's body. It simply overwhelms and depletes vitamin E stores faster than a non-diabetic. Additionally, a diet lacking in healthy fats, which are carriers for this fat-soluble vitamin, can contribute to deficiency. What are the warning signs? Muscle weakness, difficulty with coordination, dry skin, and wounds that are slow to heal. Some people might even experience night vision problems. You can boost your vitamin E intake naturally through superfoods like sunflower seeds, almonds, and avocados. When considering supplements, always opt for natural D-alpha tocopherol, and ideally a mixed tocopherol complex rather than synthetic forms. Number 3. Vitamin C, the immune and collagen builder. Our third foundational hero is vitamin C, a powerhouse for your immune system and crucial for collagen production. Collagen is the scaffolding for your blood vessels, skin, and connective tissues, all areas highly vulnerable in diabetes. It's also a potent antioxidant. Here's a critical piece of information. High blood sugar creates a fierce competition for cellular entry. Glucose and vitamin C use similar pathways to enter cells. When glucose levels are high, it essentially wins the race, blocking vitamin C from getting into your cells where it's needed. This means that even if you're consuming enough vitamin C, it might not be effectively reaching its targets. Also, because it's water-soluble, it's rapidly excreted, especially with increased urination common in diabetes. Warning signs of deficiency include easy bruising, bleeding gums, cuts that take an unusually long time to heal, frequent illness, and profound exhaustion. To get more vitamin C through food, reach for vibrant superfoods like red bell peppers, kiwi, and strawberries. For supplementation, liposomal vitamin C is often recommended for its superior absorption. You now understand why those 3 vitamins are so crucial. But now let's talk about 3 other unsung heroes that I see severely deficient in so many of my diabetic patients. They could be the missing pieces in your journey toward true healing and vitality. Magnesium, the insulin optimizer. Magnesium is involved in over 300 enzymatic reactions in your body, making it absolutely indispensable. For diabetes, it's profoundly important for insulin sensitivity, nerve and muscle function, and even blood pressure regulation. It's the ultimate cellular orchestrator. The silent enemy for magnesium is, once again, metformin. Metformin is known to significantly reduce magnesium absorption in the gut. High blood sugar also leads to increased urinary excretion of magnesium. And sadly, our modern diet rich in processed foods is inherently depleted of this vital mineral. This combination creates a perfect storm for magnesium deficiency in diabetics. What are the warning signs? Muscle cramps and spasms are classic indicators. You might also experience profound fatigue, difficulty sleeping, anxiety, elevated blood pressure, and crucially, increased insulin resistance, a vicious cycle. You can load up on magnesium through superfoods like dark leafy greens, spinach is fantastic, pumpkin seeds, almonds, avocados, and even high-quality dark chocolate. When it comes to supplements, magnesium glycinate is excellent for absorption and gentleness on the stomach, while magnesium threonate is particularly good for brain health. This is one of the most overlooked minerals, yet it has an enormous impact on your body's ability to utilize insulin effectively. Zinc, the immune and healing master. Zinc is truly a master mineral. It's essential for the synthesis and storage of insulin, bolstering your immune function, accelerating wound healing, and supporting vision. It's involved in countless processes that are often compromised in diabetes. The silent enemies attacking your zinc levels include chronic oxidative stress, which burns through zinc stores, and for those following improperly managed vegetarian or vegan diets, intake can be low. Certain diuretic medications can also increase zinc excretion. The warning signs are telling. Wounds that refuse to heal, unexplained hair loss, a weakened immune system leading to frequent illnesses, and even changes in your sense of taste or smell. If you find yourself catching every cold, or your wounds just aren't closing, think about zinc. To boost your zinc intake, incorporate superfoods like beef, oysters, if accessible, pumpkin seeds, and lentils. When considering supplements, zinc picolinate or zinc gluconate are generally well-absorbed forms. Vitamin D, the hormone-like regulator, and alpha-lipoic acid, ALA bonus antioxidant. Our final 2 heroes are vitamin D and alpha-lipoic acid. Vitamin D, often referred to as a prohormone rather than just a vitamin, vitamin D plays a crucial role in immune regulation, bone health, and it is strongly linked to insulin sensitivity and inflammation. Low levels are rampant, especially in those with chronic conditions. The silent enemies here are insufficient sunlight exposure, which is our primary source of vitamin D, and for diabetics, kidney disease, a common complication, can impair the conversion of vitamin D into its active form. Warning signs include persistent fatigue, bone and joint pain, mood changes, and a propensity to get sick frequently. You can find vitamin D in superfoods like fatty fish, salmon, mackerel, and egg yolks, as well as fortified foods like milk. If supplementing, always choose vitamin D3 and pair it with vitamin K2, which ensures calcium is directed to your bones and not your arteries. Alpha-lipoic acid, ALA, as a powerful bonus. While not strictly a vitamin, ALA is a potent antioxidant that is particularly beneficial for diabetic neuropathy. It works to regenerate other antioxidants and reduce oxidative stress throughout the body. The silent enemy for ALA is the increased oxidative stress inherent in diabetes, which increases the demand for this powerful compound. The most prominent warning sign of insufficient ALA activity in the body is the presence or worsening of peripheral neuropathy, that common tingling, numbness, or burning pain in the hands and feet. You can get some ALA from superfoods like red meat, organ meats like liver, spinach, and broccoli. However, for therapeutic benefits, particularly for neuropathy, supplementation is often needed. Look for the Republican Alabama form, which is more bioavailable than the synthetic SALA. If you're struggling with the tingling or burning sensations of diabetic neuropathy, this nutrient could be your saving grace. So, now you have a deeper understanding of these 6 essential micronutrients and how their deficiencies can profoundly impact your battle against diabetes. But understanding isn't enough. Here's your actionable 3-step plan to start turning the tide and reclaiming your health. Eat smart, food is medicine, always prioritize whole, diverse, and colorful foods. Your plate should be a rainbow of nutrients. For example, imagine a breakfast featuring scrambled eggs with spinach and a handful of pumpkin seeds. That's a power-packed meal addressing B6, magnesium, zinc, and vitamin D. Make every meal an opportunity to flood your body with these vital compounds. Test and supplement selectively. Do not self-prescribe high doses of supplements. This is crucial. Instead, discuss with your doctor the possibility of getting tested for these specific micronutrient deficiencies. If deficiencies are identified, then consider targeted supplementation under professional guidance. This is especially important if you're taking medications like metformin. While these drugs have saved countless lives, they can also deplete these precious micronutrients, and a doctor can help you manage this balance safely. Holistic lifestyle, never overlook the other foundational pillars of health. Ensure you're getting adequate sleep, actively managing stress, engaging in regular moderate exercise, and nurturing your gut health. These elements create an environment where your body can better absorb and utilize the vitamins and minerals you're putting in. They are not secondary, they are integral to a thriving, resilient body. This isn't about finding a magic pill. This is about adopting a comprehensive, informed strategy so that you can not only control your blood sugar but truly recover and regain your vital energy and life. If this video has opened up a new perspective for you, please like it so I know you want to see more content like this. Subscribe to my channel to ensure you don't miss out on valuable health tips every single week. And please share this video with anyone you know who is struggling with diabetes. They deserve to know this truth and to have this empowering information. Finally, don't forget to comment below. Tell me which micronutrient deficiency you suspect might be impacting you the most, or if you have any personal experiences with micronutrient supplementation for diabetes. I'd love to hear your story and your insights. Want to learn more about crafting a specific nutritional meal plan for diabetes? Then make sure to check out this video next.